Today is the 10th day of our series, How to be Homeopathic Specialist. Yesterday I promised you how to deal with the different types of patients. How to deal with the different types of patients. So whenever you open a clinic, you get a different types of patients. First thing, you get a patients who really want to take a treatment. They are very simple, innocent people. They come, they trust in you, and they just simply tell their history, and they are very innocent people, maybe illiterate people coming from villages. They are really not knowing anything about homeopathy and other things. They just ask very simple. I think they are the best patients. They trust you, they come back and they gave you all name and fame. Maybe they are not knowing anything about it. So be very sincere about this patient. Try to help them maximum. This is the real patients category. Then the second category comes with the literate people. Those now internet days are going on, the little literate people, they go on website, they search about homeopathy and all these things, and they come to you with lot of questions. Most of them have taken treatments with other doctors, and they will ask you, doctor, this is my case, what do you think about this? Will you be able to cure me? And how does homeopathy work? Does homeopathy will be able to help me or not? So all these questions, please don't go in a theoretical way. Just simply tell them, okay, I will try my level best and I will answer you. I will just study your case and then I will let you know whether I will be able to help you or not. So first of all, you just give me the plain information that I want from you. Try to take a plain information and ask them, don't use any medical terminology. Simple questions, simple answers. And that is only thing that I need from you. Sometimes they will also ask you, why do you ask me these questions about what I like and what I don't like, how is my disposition, whether when I get angry. You see, it's just for the selection of a remedy I needed. You just don't think of it. It is my part. So try to give the short and curt answers. Don't go in details. The more details you go, so instead of giving the treatment, you'll fall in discussions. You'll fall in all these discussions, and discussions won't help him to cure, neither it will help you to give him medicine. So be very strict about them. You say, my aim is not to prove that, to give you the best remedy. And once I have given a remedy, let us see what happens next. Don't promise. They will also ask you how many days it will take. You say, no, I cannot say exactly, but roughly it may take 6 months or a year or something. Just always tell them. They will tell you, will I be cured? Like, if you respond well to the medicine, then definitely you will be cured, but it depends how you respond to the medicine. Always put a ball in their goal. Always, not to your. You see, I give the best medicine according to my knowledge. And anyway, if it doesn't work, next time we'll see another thing, what can be done. So you be clear, be experimentative to them, and that way you can make them, convert them. Once they get well, when they feel really okay, they will be very happy. They will say, Dr. So-and-so, you don't be happy, don't be excited. You say, okay, you have felt well, then let's see what happens next. Always go according to the procedures. Unless and until complete cure is established, don't expect anything more. You can fall back. And always keep the patient very sincere. And you say, you have to follow these things and you have to do this. This simple thing, we need not explain. Then the third type comes, which are very critical patients, which are very inquisitive patients. They may not take you a treatment, but they'll ask you 100 questions. Be aware of all these people, because you will be losing your time. Then instead you use that time for other patients who are really very sincere. But always these patients will come and you have to tackle with them. So humbly tell them, you see, doctor, this much I know. You see, mister, I know this much and I can help you about that. And anything extra, what you questions, how the homeopathic works, what is there in homeopathic medicines and all this. Give small little answers. And if they go in much detail, then you say, okay, you better go to the college and you. I'm not a teacher, I'm not teaching homeopathy. Someday I will start a course, then you can get admission to that. But if you want a treatment, only for the treatment. What information is needed by me, you will give me that, and I will be limited myself to give a treatment. This is to be very clear. Neither by improving themselves that you are a great doctor or your homeopathy is great, it is not going to help. They will never convert. They will always go asking questions. They will go to other doctors. So be aware of these questions. Then the next category comes. People come from other doctors to you, especially homeopathic doctors. And they will say, you see, I have been to that doctor and I have taken 3 to 4 years treatment, and doctor, I didn't get any result. So what do you think you'll give? You say, okay, sit down, let me see. Never talk anything against about the other doctor. You see, he is also a good doctor, he is a homeopathic doctor, definitely. I don't know why, what went wrong and you didn't get the relief, but okay, let me try my levels best. But I don't promise you that I will be able to help you. Your case must be a very difficult case, complicated. That's why you didn't get the result. Don't blame your doctors. Always ask the patient that you might not have given the proper information or something like that. Let me see what I can help you. Be very clear. And the last thing what I used to do, that whenever a patient used to come to me from my friends and he used to say I didn't get result, I'll just, okay, you sit, I'll call him. I used to call him. I say, Dr. Patil, this is a patient, he has come to me from you. He has taken your treatment for 2 to 3 years. And I had very good relations with all my friends. And they opened the case and they used to say, Doctor, he has taken only 3 months treatment. Then I used to answer, you have taken only 3 months treatment, not 3 years. How you can get the result? You also take a 3 months of treatment with me, definitely I won't be able to help you. You better go back to the doctor. He may be able to help you. But it is your choice now whether you want to take the treatment with me or with that doctor. You see, the patient will be very sincere. And why the people tell you that they want to challenge you. So never fall in that challenge, because then it will be difficult later on for you. Then every month he will ask you, what doctor, you tell me, you didn't get the result. So no, you need a patience, you need a treatment for 6 months or 1 year. I will try you, all these things. Be very clear. And this is the politics of the patients. Many times they play the game of talking something wrong about the other doctors and thereby taking your consolation from you. So you be aware of all these things, don't fall. And the next category comes, I have an experience that many patients comes and they say, sir, I want to discuss a case with you. I say, discuss? I don't discuss, I treat the patients. I don't have time to discuss. No, why should I discuss with the patient with you? No, there is a case and there is one thing that thing and with the I said, so I have no time to discuss with the cases. If you want to take my treatment, then only I will be able to help you. No discussions at all. Yes, I can discuss with the doctors, but not with the patients, because they don't have any criteria to discuss with me. So to be very, very careful about the patients who say, I want to discuss with you. Why discussion? It's only consultation, no discussion at all. So don't fall in it. Whenever we are new, we just do all these things. We are hurried, we are impatient, and we are not confident. So this is the suggestion I give you. Next thing I found, many patient comes. They are very cunning patient, very mostly they come or they have been sent by other people to you to test your knowledge, maybe doctors. They come to you, you start the treatment, just start your questions one after another. How much time it will take? What do you think about my case? And all this. And gradually, you also fall prey to that. You also do things. And they want to extract your knowledge. And gradually, the moment you see, the moment I smell, yeah, he has come and he wanted to extract my knowledge and he is not going to take a treatment for me. I said, I think I should tell the patients, okay, that's enough for you to know. And I think you should take the treatment. If you ask any more questions, sorry sir, I'm sorry that I don't know or I'm not able to answer you and I'm a little busy, we'll talk later. Can you come afterwards? Finish. I'll say, okay, it's alright, but we'll talk later. Now there are patients outside and I have to attend them. So for you, I think it is over. I just cut short. And that's all. That is the main thing you have to deal with these sort of patients. Then, actually, one of the key that I always use in my practice, you see, there are three type of patients mainly. Number one, who are really frightened, simple patients, and they need your assurance. They are very simple people. They trust in you. So they just want an assurance. Doctor, I will be okay. You take treatment. You will be there. Some patients can tell because they are very frightened. They are anxious, and for them you need an assurance. Okay, I will be able to help you. I will try my level best. Okay, you take the medicines. Come on. That way. Then there are second type of patients who are against, who are not having any trust in you, but they want to take the treatment. They say, okay, you just tell them, I don't think that I will be able to help you much. Let me try. Your case seems to be very difficult. It's a challenge for me. But okay, let us see what happens. Be very clear to these people, patients who don't trust them. Don't make them to trust you. Rather tell them, okay, let us see. I can do it. I don't think much about so far I see in it. No, I just have to study a lot. I have to do that. Let's see. I can help you. Come little backwards, back step, and put them that okay. I think this is a very one of the those people who don't trust me. I don't trust them much. So, and the third type of patient comes. That is, they don't have a trust in you. They are very simple scientific patients. They are very normal patients. Okay, but they are not simple also. For them, he said, okay, it's all right. You take us the case. I think I will be able to help you. Let us try it. And very simply say what happens next time. Then step by step we'll see. I will see next time what happens. Then I will take the judgment whether I have to change the medicine or this. I will do that. And another thing, all these patients also are okay. Doctor, do you want to change the medicine? Are you given the same medicines or the another medicine? Increase the power. Need not answer all these questions. I will say that when I have done the best thing for you, I want to do. And this is none of your part to ask me whether I should. Many times they tell you, change the medicine. Doctor, sir, वो medicine अच्छा बदल दो. Why? I will take the decision whether I have to change the medicine or not. The best thing I want to do, I will do for you. It's not that you insist me to do it. Because every time then he will torture you. He will torture you, no, that medicine was better, that medicine was better. Then don't try to allow him to interfere in your procedures. Be aware of these people. So these are all the things you have to take care of it. And again, I will be telling you more and more things in my practice also. And I will tell you about the follow-up with the patients, how to take the follow next time. So what are the things to be taken in follow when the patient comes back, when the patient, whatever he says, what should be your attitude. So thank you for today. So again, we'll go next time for the next issue. Thank you.